This is the No More Wasted Days podcast, and we're your hosts, Sara Kaufman Bradstreet
and Heather PG. Grab your favorite NA drink and listen as we share vulnerable stories so you never feel alone on your alcohol-free journey.
And gain insights from us as we break down our most used tips and strategies that have kept us alcohol-free.
It's time to break free from wasting any more of your days to the drinking, blackout, hangover cycle. Welcome to another episode of the No More Wasted Days podcast. I'm one of your hosts, Heather.
And I'm Sara.
Before we dive into our topic, which is ADHD and alcohol, I want to invite you to rate, review, and share the podcast in honor of our anniversary.
Yeah. Oh, man. Do you think we can get to the 100 before our 1-year anniversary?
Let's do it. All right, y'all. We got a goal. Let's do it.
Maybe we're already there by the time this one goes out and people will be like, you're there. And if we are, then give us more.
Yes.
Give us more.
It helps us stay visible to help other people. It's the best and absolute free way to support us.
Yes.
All right. So today we're going to be talking about ADHD, which is hyperattention deficit. Wait a minute. My ADHD got me. ADHD is attention deficit hyperactivity disorder. I don't like that word disorder. I don't make the rules. And it's a neurodevelopmental condition that impacts several aspects of behavior and cognition. So I first want to say, there's all kinds of ADHD, hyperactive, inattentive. I believe it's all on a spectrum. I personally have the hyperactive kind, which is very uncommon, so they say, in school for women or girls, because you typically picture the rambunctious boy and the little girl poised in the corner. Well, I had to mask to do that, not knowing that's what I was doing, because I cannot still, look at me right now, moving my hand. I don't know why. And I have always talked a lot, and I've just had a lot of energy inside my brain, inside my body, and I cannot be still, and I'll be bing, 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 both brain and body. And the more inattentive is when you kind of drift off, inability to focus, and sometimes with inattentive, you really struggle to get tasks done because you've thought about it so much, then you can't do the execution piece.
Okay.
I'm extremely good at the execution piece, probably because the hyperness is do something with this, right? Move your body, you're going to explode in your brain. So that's just a little bit of my story. I was diagnosed in my 20s. And I remember I was talking to my doctor and I was like, do you mean to tell me that other people go to bed and they don't think about why you don't see hamsters in the wild, only in pet stores? He was like, correct. I was like, what do they do? Do they just think about nothing? Is it black in there? And he was like, yes. I was like, what? And I was like, so people's brains are not like hamsters on a wheel. Not everybody's brain? He was like, not everybody. So I was like, this is bonkers. So then I got diagnosed twice when I was in my late 30s, early 40s. And if you're hearing this, you're like, well, I don't have a diagnosis. You don't need one. Really, you just need to learn strategies to manage it. If you want to take medication, which they make all different kinds, some are habit forming, some are not, then you would need to see a psychiatrist or a doctor to get that, obviously. So
yeah. And I think so many of the things when it comes to ADHD, I'll be like, oh, I see that in myself. I don't see that in myself. And I see that, I can go through the different things. I think the main piece is to say, oh, I see that in myself. And then to start figuring out how you can make it work to your advantage and how you can create, I don't want to say workarounds in your life, but I guess that's kind of what it is. Create those workarounds in your life to almost make it your superpower. And go,
yes,
well, yeah, maybe this is something I do. Because when you talk about the always moving, I'm like, oh, yeah, that's me.
yes.
Even as we're recording this, I'm under the table, twiddling my fingers, always moving something.
Mm-hmm. And some of that could be nervous energy or just, caffeine. But if you just notice, my family will be like, oh my God, you can't sit still. 1 minute I'll be on the couch, next minute I'm doing dishes. It's a wonder I can keep life together. But I have a lot of strategies and behavior modifications in place that I've been working on since I was in high school. I didn't know
Yeah.
why, but I knew, okay, you're going to go to college. You have to put in your keys. You have to not lose half your life. Like,
Yes. And that was me as a child losing things all the time. My room was a disaster, not like what people, when people are like, my house is a mess, and you look and you're like, their house isn't a mess at all. There's like a few things laying around. That's like my house normal. But my room as a child was you couldn't see the floor disaster. And my mom is totally opposite, very very organized, structured, and I think she couldn't figure out what to do with me, and she was always, "Oh, if your head wasn't attached to you, it'd fall off," right? And because of that, I still have to be like, "The keys go here," and
mhm,
my husband's very similar, so we have to both say to each other sometimes, "I'm putting the keys right here," but it is nice because we both can't really get upset with each other when we're losing things repeatedly. But yeah, it is just those little things, and when I hear them from other people, I feel very seen. I'm like, "Ooh,
mhm.
that's me. I've done that."
Yeah. Oh, yeah. So I think it's like just to break down kind of what you will see in folks with diagnosed or undiagnosed ADHD, impulse control. So when we have difficulty controlling impulsive behaviors, that could be acting or speaking without thinking. I call this an indoor thought versus an outdoor thought, making hasty decisions, struggling to delay gratification, and the impulsivity can really contribute to risky behaviors like using alcohol and other drugs, right? What is
Mhm.
so odd to me is that alcohol and other drugs cause increased impulsivity, increased acting or speaking without thinking, making hasty decisions, risky decisions, so on and so forth.
Yeah. That can contribute to or struggling to delay gratification. I always say we've got to do an episode on what makes the person that ends up with alcohol use disorder. And that also is the person that smoked cigarettes, basically me, the person who can't smoke weed responsibly, the person that can't eat Cheetos responsibly. What is it? Because even like pre workout, well, I abused it so much that I had to give it up. Like, it is just like, "What is it?" And now I'm like, "Oh, maybe it's ADHD."
So many people that I work with one on one, not all of them, most of them have undiagnosed or diagnosed ADHD. I think that alcoholism and that going hand in hand because of dopamine.
Yeah.
We are already dopamine depleted with ADHD, and then alcohol gives you so much dopamine. It's like, ooh. So focus and attention. Golly, the story of my life. I was on the phone like with my sober bestie, and I like had a squirrel moment, but it was literally a squirrel. I was like, oh
I
my God,
love
there's a
those.
squirrel. I like not just a brain moment, but like an actual squirrel. Anyway, see, it just happened. So, like folks with ADHD may have a difficult time focusing on tasks or conversations, like I just did about the actual squirrel. And they switch between activities without completing them. Oh my, it's a story of my life. Easily distracted by external stimulus. And that can lead to frustration and decreased productivity, which creates stress that we drink over.
Oh, yeah. I love that's the story of my life. That's the story of my husband's life, starting projects, not completing them. That's our house build.
That's my life. I'm like looking around my house like, wow.
And I'm always like, "Okay, when we get occupancy, man, we're gonna go room by room and finish it." We won't.
Yeah, and it can really contribute to people being late or tardy a lot in their life. And I'll
Mm.
give you a really great example. My whole life, like me and my ex, we would go, this was years ago, like I was in my 20s and 30s, we would get ready to go to dinner. And like she would be at the door and I would be loading the dishwasher. Why? I'm going to sit, what? And like, and I would start a task and then I look down and I'm like, for God's sake, I was supposed to be there 5 minutes ago. So now what I do is tell myself, don't start another task. Don't start another
Mhm.
task. Don't start another task so that I can be on time.
Yeah.
Because I think some people are like, oh, it's disrespectful or they just don't care. Maybe their brain is like mine and they somehow wound up loading their dishwasher. So,
Thank goodness their dishwasher is loaded, though.
right? Like, why? It just doesn't make any sense. But it's this thing, like, you get distracted, you see it. Then the impulsivity is like, I have to do this now.
Yeah.
And then you're late for your whole date. And the dishes will be there, I promise you.
They always are.
So, and another part that I don't think is talked about that much is emotional regulation. So ADHD affects our ability to manage our emotions effectively. We can have mood swings, irritability, overwhelming intensity of emotions. If y'all have been listening to a while, you might know that emotions were and continue to be my main focus. One of my main focuses in being alcohol free because they pain me, literally. And I think this is why, like, they're so overwhelmingly intense.
Mhm.
They're really hard to cope with when you are a deep feeling person and ADHD, which is they're so damn intense.
Yeah.
So what do you do? What did I used to do? Drink over it because I really feel like if you looked at it like from pounds of to pressure, like some people might feel something on a 16, I feel like it on 116.
That's
So
super interesting to me.
yes, and like the lack of regulation, you start feeling overwhelmed, frustrated, and then you drink over it to self-soothe, which we all know doesn't dampen those strong emotions.
Right. We all know now,
Yes. It doesn't work. I tried it for 20 years. I'm here today. It doesn't work.
right? Collected the field research.
Oh, yeah. So, why do people use alcohol to cope with ADHD? Self medicate, whether it be alcohol, marijuana, cocaine, any of alcohol or other drugs, because I think we think it manages the anxiety, the hyperactivity, the restlessness. And alcohol, in particularly, and marijuana has like that sedative effect that can provide the relief from your overactive brain and body.
Mhm. Yeah, they both shut it down. That was for me, for both of them. My brain is always thinking. Without any substances, this is something that still kind of will get on my nerves about me in my alcohol-free journey, is that my brain is always on until I finally go to sleep.
hmm
And it's just kinda like, "Oh my gosh," I have a hard time sitting and watching a show without doing a few other things because 'cause I'll be like, "Oh, I gotta check this. Oh, I need to do this thing." It's just
Yes.
constant.
Best way to watch a movie for me. It's not that I don't want to watch a movie. It's not that I'm not interested. It's because I can't be still. I will take a junk drawer. My roommate in college implemented this with me. She would give me our junk drawer and I would organize it while watching the movie. And I would be so engrossed with the movie and pay attention, could remember the whole thing. And we had a clean drawer. Lately, like diamond dot painting is
Mhm.
what gets me to focus. And when I meet with my therapist and my coach, sometimes I put my makeup on while we're
Interesting.
on Zoom because I'm like
Yeah.
doing the thing and I can pay attention.
I crochet when I watch TV. That's my one thing that I can always come up with that'll be like, "Okay, this way you can actually focus and do something with your hands," and then it slows down all the other thoughts.
Yes. And, I just, again, alcohol can numb the emotional responses. But then they come with their own host of other emotional responses. So it's very short term.
Yeah.
And with social interactions, due either to inattentiveness or impulsivity, alcohol can seem like a quick fix to enhance confidence or ease the social anxiety.
Yep. That was one of mine right there. That was a huge one of mine. Whenever people bring that one up, I'm like, "Yes." I didn't realize I was using alcohol to numb emotion so much until I quit. Then I could see that I was, but the social situation thing was huge for me.
I was the opposite. I knew I was drinking to cope with emotions, but I don't think I realized how much I was drinking to cope socially.
I like that we have both of us on the opposite side there, just so
hmm
people, because I do think sometimes people are like, "Oh, well, I listened to that person and they say they did it for this, and that's not why I do it." And then you can find your little reasons you don't have a quote unquote problem. And I only say that because that's what I did.
Oh, me too. Me too.
Yeah.
So before we go into the strategies to help manage ADHD and alcohol, I want to invite you to check out the link in the show notes. Come join the Daymakers. Come work with me one on one. I have some spots available and we can really talk about this and work on it together.
Yeah. I have to say, this is a topic we discuss a lot in the day makers too. And it's cool to hear everybody's different perspectives. And then you can start grabbing what works, the little pieces that work from you to make your very specific sober toolkit.
Yeah. So strategies to help healthy coping mechanisms, mindfulness, meditation, deep breathing, guided visualization can help increase awareness and improve emotional regulation. Physical movement. Regular movement of your body can help manage the hyperactivity and improve the mood swings by increasing dopamine and serotonin in the brain. Yesterday, no, it was the day before yesterday, I felt like I had ants in my pants. I'd gotten really irritated by something, and I went to my new favorite store, Lowe's Hardware. And it was a little chilly, kind of damp here, and I could get my steps in and like release some of that energy.
Yeah.
And I needed to get out of my house. So, Mhm. Mhm. Yeah, sounds great. And what are the structured routines? Or, we talked about on one of our episodes recently the word structure. We can call it resilient routine. Implementing consistent daily routines can reduce stress and it can create a sense of stability. And breaking tasks into smaller, manageable parts can help maintain focus, or doing the timer method. Yes. One hack I have for that, say I know certain tasks take 10 minutes. I'll do a playlist, 2 songs that I really like, and the third song I don't like as much. So I know on the third song, it's time to wind down that particular task. And like keeping your keys in a specific place or putting ear tags on the things you most frequently lose, like your keys or wallet, and like putting the Find My on your Apple devices, for example. I personally like the keys live here, the things live here, and make that a practice. And it will build that muscle and you won't feel so stressed and dysregulated. And impulse control. This is hard. So pause and reflect. You have to train yourself to do this. You have to train yourself to pause before acting on the impulse. That could be counting to 10, taking deep breaths, walking away. Count 5, 4, 3, 2, 1. Sing your favorite tune in your head. Pause. Just pause. Count to 3.
Hmm.
Like 1 Mississippi, 2 Mississippi, 3 Mississippi. You have to train yourself, and it's a practice. And set your boundaries. Great day. I bet every episode I talk about setting boundaries. You talk about meditating, I bet you're like, well, put a boundary around it, Sarah. But really limiting access to situations where impulsive decisions are more likely, and when alcohol's present. Put those boundaries in place. Have
Yeah.
an accountability or accountability partner. Me and my friends do this a lot. And working with a coach or therapist who can offer support and reinforce positive choices. I'll give an example of what me and my friend do. One of the things that I delay gratification from is going through my daughter's closet. It's emotional because when I have to like donate her clothes that she's grown out of, oh, good Lord. So she and I will be on the phone. I'll do the task and she'll open her mail. It really helps.
I've heard that with other people, and even the having someone just be with you while you're doing the
Mhm.
task type thing. I listen to what I call my Keep Me Company podcast when I'm doing chores.
Yes, I've heard about that. I am going to try that today after we record.
It's like they're just the podcasts of just people chit-chatting. It's like you had a friend with you.
That's really cool. So, emotional regulation support. Again, therapy, counseling, cognitive behavioral therapy can really be effective in teaching skills to manage emotions and reduce impulsivity. Journaling, like tracking those emotional triggers, using the feeling wheel, and like track your triggers and responses, not your reactions, your responses. And that'll allow for better management of the reactions over time.
I like that idea a lot.
Yeah, because we want to listen and respond, not react.
Yeah, exactly.
And then medication, like I mentioned earlier, they have non addictive and other medications that help balance the neurotransmitters and improve overall emotional stability.
And I didn't know they had ones that were non-addictive. So that's a really good resource to have in your back pocket if you are
Yes,
looking.
yes, they do. And I have taken both and they're helpful.
Good.
So
And
I'm going to give, oh, go ahead.
I was just going to say, I think it's really important because I think that's something, especially people on an alcohol free journey might say, well, I don't want to do a medication.
Mhm.
But if you were self medicating with alcohol, you were not doing it properly, right? And if
Correct.
you can work with a medical professional, it'll help so much. So really think about it that way and go, okay, well, I was trying to do it myself and it wasn't working. So if I work with a medical professional, maybe it'll be a better deal.
Yeah. And I hope y'all take these resources that I'm about to give you and use them. Because again, if I had known how much ADHD and alcohol were woven together and that I was using alcohol to cope for with I knew I had well, I knew I had an alcohol problem and I knew I had ADHD, but I didn't put it together till I quit.
And so many people, when you talk to them, are very similar. And you'll go, oh, okay. I can see that now.
Before I give the resources, I also want to say, like, if you think like, oh, everybody's neurodivergent now, it's just a trend. No, more people are just talking about it. And I believe there are far more neurodivergent people in the world than there are neurotypical.
I believe that too. Yeah. And I think I feel the same way when people are like, well, it's just a thing now. Cause I'll even tell my mom, I'm like, Mom, I totally have ADHD. And she's like, no, you don't.
I know my mother does.
And I'm always like, oh my God, Mom. And she'll just be like, no, your husband does. And I'm like, it's me, Mom. We're talking about me.
Yeah. And my dad did. And I know my mom does. So, like, and two, it gives you good insight because if you have children and one, like you or your partner, have ADHD, your kid's probably pretty significant risk for having it too. So, resources. You can visit CHADD.org. That's CHADD, stands for Children and Adults with ADHD. And it can give you information and resources. There's like support groups, educational programs. Check it out. And then, work with like an ADHD coach with strategies, tailored strategies for managing symptoms and navigating life without alcohol. A book recommendation that I highly recommend is Scattered Minds by Gabor Mate. He is a medical doctor. He's fast. He's amazing. All of his stuff is amazing. And this
Mhm.
book is really great and it touches a little bit about ADHD and alcohol. He also has great YouTubes about addiction, particularly. There's lots of podcasts. He's awesome. Then there's Driven to Distraction by Dr. Edward and John Ratty. It's kind of like a comprehensive guide to understanding and managing ADHD. And the Mindfulness Prescription for Adult ADHD by Lydia Zalwaska. It combines mindfulness practices and ADHD management techniques.
That one sounds like my book right there.
So some apps. The Habit app could be a way to like incorporate routine. It's free. And Goblin Tools is one that I use. I think it's like $1, but it can really help.
What does it do? I wanna know
So
more.
it can like if you do a brain dump in there, it'll tell you what to do first. Or say like with ADHD, it's like your emotional intensity and you're reading a text that you don't quite understand what they're trying to convey. You can put that in there and it'll tell you the tone and maybe what they
Cool.
really mean.
Okay. It's like ChatGPT, but better.
Yeah, I
Like,
think it's
a different way.
a different way. And there's just tools in there to help you. Like, what do I focus on first? What do they mean by that? How do I respond to that? It can help with that response versus reaction.
Yeah.
And there's another app that I have not tried, but I'm going to called Focus at Will. It's a musical or a music app designed to improve focus. I'm definitely going to try this. And then Headspace or Calm or Balance for emotional regulation and self control. If you're thinking, I have ADHD, how in the world am I going to focus? I'm here to tell you it works.
Mhm.
So that concludes our ADHD and alcohol episode. I would love to hear what you thought. If this was helpful, share this with a friend, a family member, or like, is this me? Or, hey, I think this might be you. Love you, mean it. But, really think about it and get curious. Try not to judge yourself. And if it lands and you want to talk about it, come join the Daymakers and work with me one on one.
Awesome. Thank you so much for sharing this information because I think this will be helpful to a lot of people.
I hope so. That's our hope. All right. We'll be in your ear next week. Bye, y'all.